Good afternoon, everyone. Hi, my name is Mark Baker, and I have the distinct pleasure of introducing our afternoon speaker for our plenary session, Tori Cooper. Ms. Tori Cooper is a health and equity consultant, CDC subject matter expert, educator, published author, and leader in the transgender and HIV communities, who recently was honored as one of the most influential LGBTQ Georgians by Out Georgia in 2020. Come through, girlfriend. She leads with more than 30 years of experience at all levels of HIV service, from volunteering to her role as executive director and founder of her own consulting agency, Advocates for Better Care Atlanta, LLC. She proudly serves as the Human Rights Campaign's Director of Community Engagement for the Transgender Justice Initiative. In this role, her focus includes economic empowerment, capacity building programs, public safety, and expanding public education campaigns. Ms. Cooper was recently sworn to the Presidential Advisory Council on HIV/AIDS, PASHA, which provides advice, information, and recommendations to the Secretary of Health and Human Services. Please sit back, relax, and enjoy the afternoon plenary session. Take it away, Ms. Tori Cooper.
Good afternoon. My name is Tori Cooper. My pronouns are she, her, and hers, and I am the Director of Community Engagement for the Transgender Justice Initiative at the Human Rights Campaign. It's my honor to be here with you today and do a presentation on SAVA and the transgender community. SAVA is an acronym that stands for Substance Abuse, Violence, and HIV and AIDS. Our session goals are really simple today. We're going to define some key terms related to both the transgender community and also to SAVA. We're going to address factors for the transgender populations that can apply to other communities as well, but this presentation is specifically for my trans brothers, sisters, and others. We're going to understand the syndemic approach to treatment, and we're going to address some, not all, but some barriers to care. SAVA is an acronym for Substance Abuse, Violence, and AIDS. SAVA syndemic defines the concurrent, intertwined, and mutually reinforcing health and social problems of substance abuse, violence, and HIV/AIDS that plague the urban poor. Transgender is an umbrella term that describes people whose gender identity differs from the sex assigned at birth. The transgender or trans or TG community, you'll see those different terms used throughout this presentation. It's quite diverse and truly underserved in research and also in resources. The Williams Institute at UCLA estimated 700,000 trans people in 2011, which was updated only 5 years ago, only 5 years after that, to about 1.4 million people. Now that says a whole lot. It says either we had a whole bunch of trans babies in 5 years, or it really speaks to the inability of larger institutions to accurately count the number of trans and non-binary people that exist. It's important, and it's really impossible to get an exact count due to a variety of social and structural reasons. The variance in numbers shows inconsistent data collection and a lack of sufficient data. Substance abuse. Transgender adolescents have higher rates of illicit and prescription drug use when compared to non-transgender adolescents, according to a new study. The study, published in the Journal of School of Health, found transgender students were 2.5 times more likely than non-transgender students to use cocaine and methamphetamines in their lifetime, and twice as likely to report the misuse of prescription pain medication. Injectables. In trans women, estrogen helps develop and maintain a feminized body, enhancing breast growth and the redistribution of fat. A sudden loss of the hormone can result in emotional changes. A long-term loss will cause those physical changes to slow down and for some even to reverse. Health experts and trans women alike have called the injectables life-saving. A common quote that we've seen often by Kristen Aquist says, "It meant seeing me in my body for the very first time." And Kristen is identified as a California trans woman, according to an article by The Guardian. Dr. Asa Radix recalls that the first time the drug was in short supply, one of his patients obtained what she thought were estrogen injections through a friend. At the woman's next appointment, the results of her liver test set off sirens. "We still don't know what she took," Radix said. "People can fill vials with whatever because they know that people like me, other trans people, that we're desperate." The patient gradually recovered in this particular case, but it really speaks to the importance of injectables as a lifeline, as something that reaffirms who we are as individuals. The prevalence of cocaine and amphetamine use among transgender people in Ontario, Canada, was higher than in the age-standardized reference population. Social exclusion predicted within group variation in drug use among transgender persons was a contributor. An estimated 12.3% of transgender Ontarians had at least one of the specific drugs in the past year with no significant relevance to their gender identity. Transgender Ontarians were more likely to use both cocaine as compared to the age-standardized non-transgender population. A history of transphobic assault, homelessness, or underhousing, and sex work were also associated with greater use among transgender persons. Dependence rates. This is a graph that shows some of the different dependence rates of, this is taken from the National Institute on Drug Abuse. As many of you are familiar, more people are addicted to tobacco than any other substance that we're aware of. There's also, with the exception perhaps of alcohol, but based on this particular study, we're looking at dependence rates based on tobacco, heroin, cocaine, alcohol, caffeine, and cannabis. This graph was done a few years ago, and I'm sure, I would imagine that with the legalized use of cannabis, that it is quite possible that some of the order has changed. But this does give you a visual representative of what dependence rate looks like based on this particular study. This is not a trans-identified person, but I thought this was an incredibly powerful, impactful set of images. What it does is over a 10-year period, we can see some of the effects, the visual effects of what consistent substance abuse looks like. This is a person in this particular study. When I saw these images, I was absolutely mortified, but I also realized that this is what people who are dealing with consistent substance abuse, chronic substance abuse, these are the types of things that their bodies are experiencing. What we have is someone who looks relatively normal. She was incarcerated in each of these different years. She was arrested. And we see in just the 10-year period how her face and her body changed so drastically. One of the things I also tell when speaking to and with and about trans individuals, when we're talking about substance abuse, it's also important to remember substance abuse kind of works, I tend to call it like a microwave oven effect. It kind of cooks things. It cooks the body from the inside. It cooks the brain from the inside. So by the time you're starting to see results on the outside, so much of the damage has already been done. Addiction is primarily a psychological disease. Very, very important to remember. The majority of alcoholics and drug addicts, these are the terms that were used in this particular study, suffer from at least one other co-occurring issue, such as the following: depression, borderline personality disorder, obsessive compulsive disorder, self-esteem deficiencies, anxiety or anxiety or panic disorders, eating or body dysmorphic disorders, schizophrenia. Smoking is a serious health threat for everyone, but it's especially dangerous for people who are living with HIV. Smoking raises your risk for heart disease, cancer, serious lung disease, and infections such as pneumonia and other illnesses. People who are living with HIV are more likely to develop these harmful consequences of smoking than those without HIV. Quitting smoking can help people who are living with HIV have a better quality of life and fewer HIV-related symptoms. When you quit, your risk goes down for many serious illnesses, including heart attacks and pneumonia, and it goes down immediately. In this next section, we're going to talk a little bit about violence. And it's important to understand that violence is not just about fists and guns. Violence also exists in policies. It also exists in the way that we think about and treat trans and non-binary people. Trans Black Lives Matter, queer Black Lives Matter, poor Black Lives Matter, young Black Lives Matter, old Black Lives Matter, all Black Lives Matter. We shouldn't have to say it, but we will continue to say it until everyone acknowledges this and acts accordingly. So now we're going to watch a short video by Diamond Styles, who's talking to the roots on why Black trans rights are civil rights.
All oppression is connected. Stonewall was about rebelling against police brutality. We all have that in common. We have this arm of white supremacy that is up against us. Hi, my name is Diamond Styles, and this is a word: why violence against Black trans women is a civil rights issue. I am the culmination of red, velvety, country Mississippi women and a queer community of gay men and lesbians that showed me how to survive through scarcity, that showed me how to find the joy in all of this silly oppression. I was the first Black trans woman to attend Jackson State University in Mississippi, and they put me in a male's dorm. But what they didn't know is that they were exposing me to violence. People were trying to throw boiling water on me. Any place that I was trying to be a normal person, there was a risk of violence, risks of sexual assault, a risk of anything. We can't even get a break because every couple of weeks, one of our sisters are dying. The people who are killing us are the men who we are engaging with. Because we are Black trans women, we engage with Black men. Just like white trans women, they engage with white men. Because of our lack of economic, social mobility, we don't have certain protections to keep us safe as other girls. We don't have the resources to get the surgeries that makes us a little bit more passable. I think that every community has a level of transphobia in it. When it comes to Black men, it's so many levels to why men uphold patriarchy. And for me, I think we are just a casualty of that. They're scared, they're fearful, they're so policed in so many different ways that when they lash out, when they haven't worked through the trauma, when they haven't worked through their exploration, when they don't have anybody to talk about this without being judged, usually we are the ones who have to be the therapist, has to be the experimentation, have to be the person there who gets the negative. And sometimes when it's somebody who is traumatized and trying to deal with this stuff and explore these things, we're usually the casualty.
No justice! No peace! No justice! No peace!
At least with cis women, there is a buffer. They're not being saved. They're not being saved, but there is a moral buffer that says you are not supposed to beat your woman. But with a trans woman, that is taken away because you have chosen to totally denounce your malehood. Everything that comes to you, you deserve. It's so many Black trans women out here doing amazing work. So we have the amazing people on Pose, you know, the producers, the directors, the actors who are doing this image activism, allowing a trans character, a trans person to come into people's homes on television and connect to their stories. But then there's people on the ground with my organization, Black Trans Women's Inc. We're just creating programs to help more directly Black trans people. Recently, the NAACP voted and passed a resolution that said they want to make us a priority in protecting us. This is the NAACP. Now, have they rolled out any policies? I don't know, but they did take the step in publicly saying and voting and passing this resolution that said that they want to center Black trans folks. And I really appreciate that. I think it's a great direction to be going into. The resolution is to be more empathetic, understand the resource that you have in regards to what we can show you of how to get us off and under this oppression, and understand that the oppression that we are going through is connected to everything else. When we talk about decriminalizing sex work, when we're talking about poverty and housing, if you're centering us and you're building programs to solve those problems, I think we're an amazing resource, and I think they're sleeping on us.
This is one picture that illustrates, and these are actual victims, trans folks who fall somewhere on the trans spectrum who were killed in just 1 year. Sadly, at the Human Rights Campaign, we've reported over the last 2 years consecutively, the number of trans deaths that we've reported on has increased dramatically over the years. In addition to that, in both 2020 and 2021, we recorded the most number of trans deaths ever. 30 to 50% of transgender people experience intimate partner violence at some point in their lifetimes. The same stigma and the same sort of fear that's trying to be embedded in our society are the driving factors of the extreme forms of violence that are taking place, said Issa Noyola, who at the time was the deputy director of the Transgender Law Center. A lot of these cases are happening in regions where there are lack of protections and there's a lack of understanding and infrastructure for trans folks to live their or our daily lives. This quote was especially important to me. In 2017, when Issa made the quote, and even now, we saw through the last administration where there were constant attempts to really erase all the few protections that existed for trans people in the government. But in addition to that, also there's a loud minority of folks who are attempting to not just get rid of the few protections that exist at the local and state level, but also to continue to create these barbaric and really violent laws. Violence isn't just with fists and guns. Violence can also be in policy. There are folks who are attempting to create these very violent laws and discriminatory laws that even prohibit trans people from peeing in public accommodations. They're really, really archaic and barbaric, and we really need to be aware that these things are happening because there are so few legal protections. And it's really important. I'm not a very political person. This is not a political statement by any means, but it's important that we understand why legislation like the Equality Act must be passed. Because what the Equality Act does is it ensures protection for all people, and not just trans people, all LGBTQ people, all people, and all public accommodations. Let's talk a little bit about HIV. Transgender women who are living with HIV, there are a number of studies globally that report the number of incidence of HIV, prevalence of HIV in transgender communities around the world at around 19.1%, and in the United States, 21.6%. Many of us, particularly those of us who live in the South, believe those numbers are even higher. And what we'll see later on in this presentation is that when we aggregate the numbers, that we're looking at folks who live in the South, that when we're looking at people of color, and then even more specifically, Black and Brown or Black and Latinx or Hispanic trans people, that those numbers are much, much higher than the averages of 21.6%. 1 in 3 trans people surveyed in DC are HIV positive. 19% of trans people surveyed have been refused medical care simply because of their gender identity or perceived gender identity. EverydayHealth.com cites that 20% of trans feminine individuals are living with HIV in a study of 98 different studies in 34 countries, with 3% of trans masculine individuals were living with HIV in those same studies. 20% in Latin America and 30% in sub-Saharan Africa. The CDC also cites that 62% of Black transgender women, which includes Black transgender women all across the country and places that have access to free PrEP services. Something to think about. 35% of Hispanic transgender women and 17% of white transgender women. One of the things that I think is also so important is we'll notice that these numbers really look very, very similar to the numbers in Black MSM communities as well. I think that's very, very telling. This is an incredible slide that I think really represents some of the issues, not all, but some of the issues that transgender women who are living with HIV face. Certainly HIV-related stigmas, they are closely at the top, but there's also transphobia or cisnormativity. And what we mean by cisnormativity in this particular case is that there's some who believe simply because you're not just like them as a cisgender individual that you're different, and that different is bad. Sexism still exists. Racism, without question, exists. Substance use stigma, that's for people who are currently using substances and also folks who have histories of substance abuse. Sex work stigma, classism, elitism, ableism, gender nonconformity stigma. There are some simple and yet effective action items that you can implement, not just in your work, but also in your daily lives. And also just give you some things to think about. Address HIV in the transgender community by providing free and low-cost physical, sexual, and behavioral health care for everyone. We have to remember access and opportunity matter. There must be targeted prevention that's both pre and post-diagnosis. And I rarely use the word targeting when talking about human beings, because you target a deer when you want to kill it. You don't target human beings. But it's important to remember that in this particular case, there must be targeted and specific prevention strategies that are implemented. That doesn't just mean stuff that's created by VCU health systems. That means making sure that the voices of trans and non-binary people are included in the planning, in the production, in the implementation, in the research, and in the evaluation processes. Develop trans-specific risk reduction strategies, life skills, and job training and education. But old lady, I'm 50-something years old. I'm 35 if any of you are single, but I'm over 50 years old. And it's important to remember that there was a time when folks were diagnosed with HIV and it meant a death sentence for them. That's no longer the case. So for trans and non-binary folks who you engage with, make sure that you're providing them the tools that are necessary to continue to have gainful employment that could lead to private health insurance, making sure that we're equipping people with life skills and job training and education that's going to continue to help them to improve their lives as you continue to work with them on their health care. Also making sure to understand that trans health care should include hormone therapy for those who want it. Not every trans or non-binary person wants access to hormonal therapy, but for those of us who do, make sure that it is included as part of comprehensive health care. It's important to increase visibility and also to reduce stigma, not just in the work, but also in the way that we engage with people and in the way that we think about the communities that we're there to serve. Practice cultural competence and cultural humility at all levels of engagement. Cultural competence in part means acknowledging that there are folks who are different than you and deserve to be treated well. Cultural humility says there are two aspects of cultural humility that I really love to nail home to people. And one is a commitment to lifelong learning. It says, yeah, I'm an expert in what I do, but I'm not the only expert. And there are people who know more about certain things in certain communities and certain people than I do. Another aspect of cultural humility is also the understanding that there must be critical self-reflection. And that's an ongoing process. It means critically self-reflect your own thoughts and actions as an individual, but also as an institution. Challenge discriminatory policies, and most importantly, pass the Equality Act. I mentioned earlier that the Equality Act really is the most comprehensive legislation that will ensure equal access and treatment for all individuals, not just trans people, not just LGBTQIA+ people, but all people in all public accommodations. Not a political person, this isn't a political speech, but we need to pass the Equality Act. And lastly, address the total person and not just one life issue. We refer to that as intersectionality and having intersectional healthcare approaches that really address who people are in their fullness. Now, just remember, trans and non-binary people just want to pee and poop in peace, just like everyone else.
Every election cycle, the American voter has to grapple with controversial issues like terrorism or abortion. But this year, the debate is taking place in an area that most of us would want to avoid: the public bathroom.
So if Caitlyn Jenner were to walk into Trump Tower and want to use the bathroom, you would be fine with her using any bathroom she chooses?
That is correct.
Proponents of a new law in North Carolina say that allowing transgender people to go to the bathroom in a bathroom that fits with their gender identity would cause the end of public schools as we know it.
If this prevails, this will be the end of public schools as we know it.
Although it's a hot topic right now, other cities have already implemented this policy. In fact, the 3 largest school districts, New York, Los Angeles, and Chicago, all already have that policy in place with no notable uptick in assaults.
So if this bathroom policy is already in place in so many areas in the United States, then why are people so terrified?
I know.
This is Chase Trangio. He's a lawyer at the ACLU, and he's transgender.
You do?
Yeah, I know why.
Why? Tell me why.
Well, I think people are really anxious about the fact that we have to share public space with people who are different from ourselves in general. And right now, there's all this attention on transgender people. So people are focusing all of the fear and confusion about who trans people are around their anxiety about the bathrooms in general and trying to expel transgender people from public space. We've seen it over and over again throughout history. The reality is that bathrooms have long been a battleground, and we saw this in the context of the civil rights movement and efforts to expel Black people from spaces that white people dominated, including bathrooms and locker rooms.
Wait, what are you doing in the women's bathroom?
If I was in North Carolina, I would have to use the women's bathroom because I was assigned female at birth. So I would be a dude in the women's bathroom. That's what the law requires.
What? Are you saying that these lawmakers are literally causing the problem that they say that they want to avoid in the first place?
Yeah, that's what I'm saying. But can you give me a minute?
Oh, yeah, sorry. To be fair, creating gender-neutral spaces is tricky. There's a rec center in New York where they allowed a gender-neutral locker room, and some parents were concerned about girls being in the same room as men.
But if these lawmakers are so worried about men entering women's bathrooms, then why are they passing a law that will effectively do just that? The biggest irony is that HB 2 and laws like it would in fact force trans men to enter and use women's bathrooms. If public officials want to spend money and time debating a real problem, it should be the dangers that transgender people face in America, like the homicide rate that has hit a historic high in the US, or the fact that 41% of trans people have already attempted suicide. Just last year, a transgender homecoming king and activist in North Carolina committed suicide. Why aren't lawmakers in that state alarmed by that instead?
And if lawmakers insist on elbowing their way into the restroom, maybe they should address the real and well-documented harassment of transgender people in restrooms. One study found that 70% of trans individuals have experienced some form of harassment in a bathroom. And bills like HB 2 heighten that danger. Bills like it, even if they don't even pass, could cause a public health crisis in the transgender community. Maybe those should be the numbers keeping lawmakers up at night.
So this is the end of this portion of my presentation. We're going to segue into the Q&A, and actually left quite a bit more time for Q&A, probably than some of the other presenters, because I really wanted this presentation to be much more interactive. I wanted to be able to respond directly to your questions in a way that helps to move the conversation forward, but most importantly, that brings change to the way that trans people are treated and cared for. Thank you so much, and I'll see you in just a moment.
What a wonderful presentation, Tori. Welcome back, everyone, to our Q&A portion of the presentation. I will diligently be monitoring our chat box, so if you have any questions, please post them. We also going to have several poll questions for you to engage in, and now I'm going to turn it over to Tori before we move into our the rest of our presentation.
Thank you so much, Mark, and thank you, VCU, for having me. I am a fan of the Virginia Commonwealth University healthcare system. I was a volunteer. I've gotten care there. I was a volunteer down at the Massey Cancer Center.
Oh, wow.
Which actually, in part, is one of the reasons why I think this work is so important. I saw how trans people were treated there and in other aspects of throughout the health system. And I'm a native of Richmond, actually. Well, I'm from the suburbs, you know, we like that distinction mark. I'm from the suburbs. I graduated from Verina back in the 1800s, because I almost told folks my age. But what we're going to do is we're going to continue this conversation. And thank you, Mark, for agreeing. Mark and I are going to, thank you very much, Ashley. Mark and I are going to do a little intersectionality quiz to show you all to demonstrate something for you. I want folks to know that all of the systems that we all have to navigate were created here in the United States for the benefit of white, cisgender, heterosexual men of a certain socioeconomic status and age. The further you are away from that archetype, the more difficulties you're gonna have in society. All right, I happen to love white men. It's a white man that approves my check. All right, I'm cool with white men, but we all have to understand that. I wasn't feeling well the day that we pre-recorded this. So for the next 45 or 60 minutes, we're gonna sock it to you. And we're also open to a lot of questions. I'm much more alert today, and leave with some action items. So Mark, this is what I'd like you to do, please. On a piece of paper, since you said you were willing to do this, we're going to do this in front of folks because I want folks to think about it. And for those of you who have a piece of paper and an ink pen next to you, I would love for you to participate. All right. Notice I didn't say do it on your phone or your computer because I'm old and we write stuff down. So Mark, I would like for you first to write down your race. Oh, Tammy. Oh, I forgot my girl Tammy is on here. Tammy, right? Can you participate too? Great. So on a piece of paper, I want you to write down first your race, comma, your gender identity, however you define it, comma, your sexual orientation, comma, your age group, age range, or age, comma, and your socioeconomic status, however you define it. And I will model for you what that looks like. So my name is Tori Cooper. I am a Black, not necessarily African-American, but I'm Black. I am transgender. I am hetero-flexible. We'll talk about that later. A heterosexual woman. I'm 51 years old, and I am considered lower middle class by other people's standards.
Okay. I am Black. I am male, gay, 53, and I consider myself middle class.
Thank you. Tammy? Can't hear a word you're saying.
You're muted, love.
Oh, you know what? She might not be able to unmute. Okay. Ashley, can you do it? I see you with your hand raised.
Hey everyone, I am biracial, Asian Latina, cisgendered woman. I am pansexual, 28, and I consider myself middle class.
Thank you. If Tammy can come on, we're gonna have her do hers as well. Let's try it now, Tammy.
All right, can you hear me?
Yes, ma'am.
All right. I'm Black, identify she, her, hers, female, lesbian, 52, lower middle class.
Girl, you probably just shocked somebody with the lesbian thing. Come back on camera, Ashley. All right, so what we're gonna do, since we have the four of us here. All right, so in society, thank you for that, Lazaro. So in society, in the United States and in the healthcare systems, we have this really ridiculous, archaic, and demeaning view that white, heterosexual, cisgender men of a certain age and socioeconomic status is the gold standard. And if you don't believe me, then go to work today, go to work tomorrow, because every single thing that we do is based around white, cisgender, heterosexual, socioeconomic status. When we look at the nutritional chart, it's based on white men, cis men, certain age and socioeconomic status. When we look at HIV healthcare, and we look at how HIV medicines interact in people's bodies, for the first 2 generations of HIV treatment, it was just around white, cisgender, heterosexual men of a certain socioeconomic status and age. All right? Oh, good. People are coming on camera because they must like this part. So this is what we're going to do with Ashley, Mark, and Tammy. If you're white, take away a comma. If you are cisgender, take away a comma. If you are heterosexual or heteroflexible, take away a comma. If you identify as a man, remove a comma. If you are in your teens, 20s, or 30s, remove a comma. If you are middle, upper, if you are upper middle class, rich, independently wealthy, generational wealth, remove a comma. Anything other than upper middle class, rich, wealthy, generational wealth, don't remove a comma. But if you're any of those things, remove a comma. Ashley, how many commas do you have left?
I have 3 left.
You have 3 left. Tammy, how many commas do you have left?
All but 1.
Oh, interesting. Mark?
I have 3 left.
Okay, so These commas represent, all of these commas that we have, they represent the more problems you're gonna have in society. Now notice we didn't put HIV status in there. We didn't put chronic disease states in there. We didn't put able-bodied versus person living with physical disabilities. We didn't put mental capacities. We didn't put a whole bunch of other things. We didn't put the ability to speak English in there. We didn't put a whole bunch of things in there. But just based on that fake archetype of perfection, people who are not white, cisgender, heterosexual men of a certain socioeconomic status and age at Virginia Commonwealth University health systems are going to have a lot of problems. What we know is that people like Tammy, who were assigned female at birth, will be recommended to have a hysterectomy at least twice as much and closer to 3 times as much as someone like Ashley for having the exact same issues, fibroids. And that if Ashley were a white cisgender woman, that it would be 4 times as likely that Tammy would get a hysterectomy for the exact same issue. We know that if Tammy was a cisgender white male who was gay, that Tammy would be about 11 times less likely to get HIV than Mark, who's a Black cisgender man. We know that racism exists in society, and we know that that racism creates barriers to care for people. And so acknowledging those things, first of all, I think is one of the most powerful things that we can do. And really is part of cultural competency and also part of cultural humility. Acknowledging that bias exists in our work. It also exists in our heads. And that it impacts every single thing that we do. If you're a white person, then you might not agree with me. You're wrong. You're wrong. I just wanted to say that. Thank you, Ashley. Thank you, Tammy. All right, and thank you, Mark. I really just had to say that because I wasn't feeling great when I was doing this, but I wanted to make sure that I added that part in because the framework of the work that we do really has to take, we have to take much more of a cultural humility aspect into the work and understand that this presentation I did, it was a presentation around the SAVA syndemic, substance abuse, violence, AIDS, and HIV. Understanding that I mentioned some of the issues that as it pertains to trans people, but you could have taken trans people out and said for Latinx and Hispanic people. You could have taken the trans out and put Native American people, which are people here before the white people got here. And before the white people who brought the Black people here. You could take all of those things out. You could have taken out all race and just put women people face these issues because it's true. And so understanding the framework that the systems that we navigate are filled with barriers and craters, and some are much more insurmountable than others. And that everybody doesn't start at the same place when it comes to seeking care and receiving care. And that bias exists in the way that we met out care. That there are still providers of medical services, folks who write prescriptions, who still say that people like me and Tammy, simply because we identify as women, don't experience pain the same way as white women do. I am a very good speaker, but I love Ebonics. I use Ebonics as if it were a master's class. And so how the hell are you gonna tell me what I'm feeling? But there are providers who say that. There are providers who do that. And so we have to understand that all of these things exist, all right? Thank you again, the three of you. All right, so white people are not the cause of societal ills, so I don't want each of you to leave this conversation and say that Tori said that, because that's not what I said. However, because I talk with my hands, I do want you to know that racism exists in this country because in large parts, that white people have created a standard, and more specifically, white men have created a standard that white is right and everything else isn't. We have to be mindful, and that's not to villainize white people, because none of y'all did it. None of you that are on this call are old enough to have created the system. So do not take ownership over that. What I am simply saying is that we live in and exist and work in a country, thank you, Kimberly. We live, work, and exist in a country where these were the rules. We have to be rule breakers and break the way that we have been navigating in this country in order to truly impact people's lives in the way that needs to be impacted. That's why I keep saying it. So I'm going to talk a lot about white people. I'm going to talk a lot about Black people and talk a lot about racism and that kind of stuff. If it bothers you, I encourage you to figure out why it bothers you so much and what you can do about it. Don't give Brad a bad review of me simply because I'm talking about race, because that's your issue. All right. So some of the problems that were mentioned in this presentation are issues that trans people face before they even arrive at VCU. There are trans people who have to get on the, what is it called? The GRTC, and they have to ride that bus from Robinson Street or from Church Hill, because remember, I'm from the greater Richmond area, and they have to ride the bus from Church Hill, and they're gonna get called out of their name on the bus. The bus driver was late. They're fighting with somebody at home, and they have to do all of these things before they show up on Marshall Street for you all to then put in their file that they're difficult to work. They express signs of anger. We didn't take into account what folks had to deal with before they got there. And for trans people, I'm not saying it's easy for anybody. I'm just saying that for trans people, some of the issues that they have to face, some of the commas, because of the commas that we use to describe ourselves, make our experiences much, much more difficult. Thank you, Brad. Much, much more difficult to navigate. It makes it much more difficult for us to access even the most basic things. It makes it more difficult for a trans person to go into who needs services for HIV care to go into a Ryan White clinic in Danville, simply because there is no mechanism to properly address them by their name. It means that when they go to a clinic in Roanoke, that the providers in Roanoke, because they know that this person doesn't have a penis, that the provider went to a church that says, well, I can't call them women men and I can't call men women. I went to a church like that too. I dare one of them to do it now. All right, we haven't empowered the folks who come in to get services for us to be able to express themselves. We have not set a tone. So I'm gonna put you all on blast for a second. Everybody in here, thank you, Kat. I noticed Kat has her gender, her pronouns next to her name. Everybody should have their pronouns next to their name. Remember, I can't see your face, and I only know a few, I do know a few of you, but I don't know most of you. And so when you put your pronouns next to your name, you're not just doing it for me, you're doing it for yourself. You're doing it so you don't make a mistake. You're doing it so the other person won't make a mistake. What you're doing is you're saying, this is who I am. And so in the work that we're doing, we're creating barriers for people because I'm telling you, my pronouns are she and hers, and you're saying, no, they're not, because your ID doesn't say that. Okay, we're creating barriers for people to get the care that they need simply because of archaic and barbaric thinking, all right? I still have a Virginia driver's license. Well, it's not valid anymore, but I have a Virginia driver's license upstairs in a drawer. I don't live there anymore. So what my ID says doesn't even matter, does it? We have to think about those things when we're providing care to people because they weren't there to get a driver's license. They didn't come into your clinic in Bluefield to get a driver's license. They didn't come into your clinic in Lynchburg to get a driver's license. They came in there to get some HIV care. They came in there to get something that you're there to provide them with. And so we have to take down some of those barriers. So let's talk a little bit about violence. And then we're gonna do the poll because I know we want to, hi Juan, glad to see you on camera. So violence is not just with fists. Violence also comes in terms of policy and policing and words and thoughts. I want us to remember that in order to be the most effective provider of a service, your thoughts matter, but your opinions don't. We forget that because as humans and, and as Americans, the fact that 93% of the country is not vaccinated is ridiculous in my opinion, regardless as to what you think about vaccine mandates. The fact that many of us think that it's more important for us not to have a vaccine simply because the government says that you should. We're saying that our individual rights, what I think, in my opinion, is more important than your health. When we're telling people, I'm not going to acknowledge who you are because my opinion is this, thus, and the other, then what we're saying is my opinion is more important than your life and your health. We have to stop that. And there's some perpetuators of that foolishness on the. All right. Now we're also going to talk about some ways that we can get past that. And I'm going to give you all some opportunities to share your ideas and some questions and hopefully some resolutions. Also understanding that today we're not going to be able to get to it. And some of you are going to absolutely hate the next 30 minutes with me. But some of you are going to get some of it out, something out of it, and some of you are going to love it. I'm getting my check anyway, so it really doesn't even matter that much to me. But let's go into the poll section, okay? So I think Brad put in the chat section the link to the poll. Help me with this. All right, so let's go to the poll. Thank you so much. I appreciate it, Mark. And Mark, we used to party together back in the day, didn't we?
Perhaps.
Scandals?
Perhaps, yes.
Not old enough for scandals, are you?
Oh, yeah, I've been there.
Okay. Club Colors before the thugs took over?
Yeah.
Yeah, okay, I remember you. All right, so here's a question for you all. The first question, why do trans people need hormones as part of their HIV care treatment? All right. I would love this. This is a poll question. Who says they don't? Because I'm going to wear your ass out. All right. Continuity of care. They don't. For physical and emotional change, continuity of care. I love that. Okay. These are pretty cool. Holistic care. And I was joking about wearing your ass out. I am going to wear your ass out. I'm just not going to put you on the spot for the person who said they don't. So here's why, and please continue to do this. I want people, because this is anonymous, I want you all to feel comfortable because I am going to address it in the way that I address it. Because some of you can't hear when I speak the Queen's English. You can't hear me as a Black woman speaking to you in the same language that you're used to hearing. You can't hear it that way. So I have to talk to you in the way that I talk so that you'll get the message. Because the rest just say affirming care. I love that. Hormone treatment is basic care, basic right. So here's how I would respond to this. Many of you are dead on. To the person who says, I can't even remember. Can you scroll down the screen again? Because I want to see whole health approach. I love this. I love this. Scroll down the screen just a little bit. I want to see one of those oh, okay, got it. So one of the first ones is says that they don't. So all trans people do not seek all trans people do not seek medical care as part of HIV care. However, for those who do, I say it's important to remember this a lot, but for people who are living with HIV who are of trans experience, every part of their existence should be addressed. For cisgender women, and I'm not combating cis and trans against each other, I'm simply using them for comparison. For cisgender women who need hormonal therapy, we view that as part of HIV care because you're treating the whole person. My mom and I My mom, I mentioned earlier, if Tammy, as a Black woman, Tammy is going to be recommended to have a hysterectomy 4 times that of a white woman, because that's what the system says. A white woman and Tammy, both cisgender, can have the exact same issues, but Tammy will be prescribed and suggested that she has a hysterectomy 4 times as much as white women for the exact same issue, fibroids. My mother's one of those 4 women who was one of those who was recommended to have a hysterectomy for fibroids, actually in her 30s. It's systemic racism. There's no other way to say it, all right? It's not that fibroids are worse for all Black women than they are for all white women. It's just the way that things have always been done. We have to change that. And so as a trans woman, my mom, she had her hysterectomy early. I started transitioning on hormones in 1993, probably before a couple of you on this call were born. And so at the time, Target had the cheapest prescription for estrogen. So my mom used to we had the same last name at the time. So my mom, she would get her medicine from Target and I'd get mine. And I was visiting home and in Richmond, the greater Richmond area, because remember, I'm from the suburbs. And so we would get our medicine from the same place. And one day she picked up my bottle and she took it to work. And she didn't even know I was on hormones. And she took it to work and she looked at the bottle and she noticed it was my name and not hers. And she called me and asked about it. And I explained to her what it was for. This is years ago, 30 years ago almost. And so what I tell that to say, a lot of you, many of you are medical professionals, don't realize that what trans people are doing is our bodies with the same medicine as cisgender people. We're just going through puberty at a later time. My mom and I were taking the exact same medicine, exact same dosage. Some of you think the trans people that we're getting all this special medicine and doing all this special stuff. You're wrong. That's not what's happening. Transgender women, our bodies are doing the same thing that many of you went through at 11, 12, and 13 years old. Remember how crazy you were? Remember how emotional you were? For some of us, it just happened at 30 or 40 or 50. But we don't think about things that way. So that's one example of that was me dispelling a myth that many of us often have. Thank you, Sam, for that question. Too often we're siloed, no one provider takes the lead on the care. That's really important what you said, Sam. It says too often care falls into specialty silos and no one provider wants to take the lead on the care of the whole patient. Each of their organs will have a doctor, but the patient doesn't have a doctor for their whole cells. I totally agree with you, Sam. And part of that, as we go to the next poll question, you're right. And part of that is because medicine and HIV care systems have become overly specialized, in my opinion. Dr. Sarah Monroe used to work in the ID clinic at, thank you, Tammy. She used to work in the ID clinic at MCV. And if you need a skin tag, she was gonna figure out how to get the skin tag removed in your office. If you needed something that wasn't specifically HIV related, but she saw as part of your HIV care, she's gonna make sure you get it done. Folks can't do that anymore. Or maybe I shouldn't say can't, they don't do that anymore. And it is an affront to care models that provide the best care. We always talk about what are we going to do to get people retained in care, to increase retention rates? How do we get people to this magical status of undetectable and keep them there? Well, it's treating the totality of who people are as human beings. It's not sending them to another appointment for something that you can do during your 17 minutes together. Sometimes it's you reading 2 or 3 additional medical journals about something that someone shared with you at their last doctor's appointment so that you're prepared next time to answer their questions. It means being a provider of services, plural, and not of a service. Okay, all right, this is good. And my coffee kicked in too. Let's go to the next one. Thank you all so much, because yeah, I probably would chew a couple of you out, but it's anonymous, so you don't know who I'm chewing out. And you all aren't on camera, so you certainly can't see. So what is one thing we can do today that will make HIV better for trans people? I can't wait to see some of your responses for this. You all are gonna give some action steps. Come on, listen, whoever that was, cheers to you. Drinks on me. I drink water though. Practice cultural humility. We don't know everything. Yes. Treat them as humans. Yes. Listen to them. Yes. Education is key without question. More understanding. Yes. Listen, learn, retain, ask. Oh my goodness. I don't know who wrote that, but yes, yes, and yes. Communicate. Yes. Ask folks what they need. Oh, a queer person did that, I bet you. Somebody probably thought that you misspelled that word, but I like how you did, folks there. Expand your own knowledge. Treat them with respect. Include them in trials and ask questions. Yes, research, because I love research. That's amazing. Advocate. Yes, yes. While these are still coming in, and please, I want more of these to come in. So here's why advocate, just like love, the word ADVOCATE is not just a noun, but it's also a verb. One can be an advocate, and that's great, but it requires the verb part of that some action to take place. Certainly, you could say, oh yeah, I support trans people. I don't care how people live their life. That doesn't affect me. That's wonderful. That's being an advocate. But advocating for trans people means if you have a bathroom in your office and it says, especially if it's one stall in there and it says female bathroom, that you remove that. If you all were on camera, so Tammy, since I still got you on camera, have you ever used the men's bathroom for anything? Yeah. As women, we know that you go to an event and I don't know what the hell people do in the bathroom, but the line is always longer for women's bathrooms. And if you have children or have taken children with you to a store, you've probably taken your children to a bathroom that doesn't necessarily coincide with their gender. Thank you, Tamika. All of us have at some point. And so we have to remember stupid things. And I use the word stupid on purpose. Stupid things like bathroom bills are intended to demean people and really erase the visibility and viability of trans people. And so as an advocate, one must advocate to make sure that as many barriers can be broken down as possible. Sometimes that means something as simple as removing a sign and make it into something that just says bathroom. Thank you, Kimberly. Mine isn't either. I appreciate that. My bladder is not as good as it used to be either. Yeah, so different things like that. Also making sure that the paperwork, your intake forms allow people to identify themselves. Because one of the things that we hear, those of us who do this work a lot, people say, oh, well, I'm in rural Virginia, I'm in rural Alabama, we don't have any trans clients. How you know? How you know? Because for those who've seen me in person, here's where it sounds rude, but it's not intended to be. If you saw me picking grapes at a grocery store, you're probably, yes, update Soji, you are probably not going to assume that I'm a transgender woman. So how do you know trans people aren't in your plan? You don't, unless they tell them. And if you are one of the people, places, or things that are putting up additional barriers for people from identifying themselves, then you'll never know. You're not making it safe for trans people to tell you who they are. Hear what the patient is saying and not telling them what to think. Right, that's exactly right. Listen, learn, and then respond. These are all wonderful. I thought, so let me be honest, Mark. I really figured since people weren't on camera that they were off cooking dinner or something, but it's good to see people responsive in the chat and to the poll, so thank you. I went to a Michael Jackson concert, Michael Jackson Pepsi concert at Kansas City Stadium. Men, women, and trans people all use the same restrooms. The bladder is genderless. Woo, I love that. I absolutely love that. Yes, we are here all the way with you. I appreciate that. And so I don't know who did that. And since you didn't put your name in there, I'm going to use that. But the bladder is genderless. And I love that. Thank you. That was brilliant. Absolutely brilliant. And don't put your name in there because then I'm going to have to give you credit every time I use it. Juan, damn, Juan, you shouldn't have said it. Now I got to give you credit everywhere I use it. But that's good. Keep your personal thoughts at home. So may I respectfully challenge that? I want you. So I like knowing who my racists are. Ashley, you turned your head. I like to know if there was still a yellow book with the telephone book. I want all the races under the heading racist. I want everybody that's a member of the Ku Klux Klan to be in the Ku Klux Klan section of the telephone book under one list. I want all of them to wear their Ku Klux Klan t-shirts. I want them to get a face tattoo that says KKK because I want to know who it is and what I'm having to deal with. Because the problem is, if they look just like you, Ashley, and I don't know it, then I don't know how you gonna fuck me up. If the racists look like Juan, and Juan to me looks like a Black man, if the idiots that are transphobic and creating these absolutely disgusting bills look like Juan, and Juan looks like my uncle, then I'm in trouble. So I want to know who my racists are. I want to know. I don't want them to be in high. I want you to be proud. I want every single one. I want, if you and part of the KKK affiliate, please start wearing your stuff to work. Be proud. Be out and proud. Isn't that what they say? Come out, come out, come out. Come out of the closet. Come out of the racist closet. Closets are only for clothes and shoes sometimes. Come on out. I want to know. I want to know. I want to know. I want to know. And yeah, be transparent. Don't hide. Because if you're hiding, then you can do much more damage. All right. So there's that. Okay, this is pretty good. Keep your personal. Oh, that's what I was going to say. I got off on the KKK thing. So yeah, bring your thoughts to work. Sometimes you have good ideas and don't know it. You realize that somebody thought, whoever thought of these cell phones, that was a thought. And it seemed absolutely ridiculous to somebody at first, but they brought that thought to work. I just don't want you to take your opinions to work. Leave that shit at home. Thoughts and opinions are different. Thoughts require some type of thoughts are based on educated guesses usually. Opinions are not. Because you know what they say about opinions. And it's true. Okay, that was pretty amazing. Let's see. A friend in Los Angeles, aka with a KKK leader, he was something in the office and they said, don't wear that. No, I want you to wear it to work. So if you work for me, because I hire people too, if you work for me and you part of the KKK, I want you to wear it to work. Now, you won't be working there the next day because I don't play that. But I want you to do that because otherwise you're going to be messing my stuff up. All right. Always wear your non-judgmental hat. Treat as you would like to be treated. Sometimes treat people better than you like to be treated. Let's be honest. You all realize that many of us are sitting in our homes on Wi-Fi, looking at computer screens and earning a paycheck. How much privilege is assigned, and earning a paycheck part, how much privilege is assigned to that? So let's treat people better. All right, because everybody doesn't have that. Okay, that's pretty good. Let's go to the next question. Okay. Oh yeah, okay, this is the real bullshit right here. So we don't have transgender clients. Why is this session even relevant? Here we go. And folks, please be honest, because somebody is thinking this. So you know, that's a good response. That's a good, you may in the future. I love this. You already, that's right. Yes, somebody was paying attention. Yes, you do. Whoever wrote that is brilliant, and you're right. If you don't have any, is there come on with it? I love it. Probably because of your treatment, inclusion and education. I will say so far, I don't see a wrong answer. And if it's wrong, I'm gonna tell you it's wrong. All right, you might and don't know it. You do. Yep. Again, I know that's not the clean English. Because the transgendered community, take the D off, is expanding, and we as people need to be more receptive. Fantastic. Everyone should be educated on, never lose caregiver, friend, partners. Yes, 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 yes. We have transgender eyes, your emotional, ethical, professional responsibility with any patient that comes through your door. Preach. Are you trans welcoming? Are you sure you don't? Yes, I love this. The need to have compassion and grace, understanding of anyone different from ourselves is needed in every environment. Respect everyone, helps everyone. That's brilliant, because HIV is not gender culture specific and destroy health and kill blindly. Amen. This is fantastic. Thank you all for these. If you don't have TG, ask yourselves why. That's absolutely right. From what I know where you are, I know trans people that live in all of your areas. And I know trans people, I know probably trans people who live in all of the areas. So if they're not coming to your site, why? 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 Something to ask yourself. All right, let's go to the next question. Fantastic, I love this. Stop expecting everyone to look like, right, because y'all don't even look like you. Y'all, I have on, so, the person who I'm doing this to will know. So I told you I had cancer, and my eyebrows never grew back. These are eyebrows, yeah. And I also have extremely short eyelashes. So I don't even look like me without eyebrows and eyelashes. So we can't expect all of our clients to look like us. But some of us think that. And so why do I even do it? Because I look like an alien personally if I don't. I do. But we have to remember, everybody doesn't look alike. I'm looking at the few faces that I can see. None of y'all look alike. I don't even see two people that are the same skin tone on here. Trainings. Any resources you're looking for, nothing is unavailable. Oh, I actually wrote down some resources for additional training opportunities. Come on, Tori Cooper, she, her. Yes. hrc.org. Oh, is that my contact information? Oh, I'm gonna put my other contact information, because remember, I'm a consultant. WPATH, Standards of Care, brilliant. Yes, 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 yes. Also Fenway Institute. Okay, yes, thank you. Invite Tori Cooper to consult. Whoever typed that, you get a star today. Invite Tori Cooper with a check for consulting work. Thank you, Juan. I love you. Thank you. All right, yeah. Also remember, people do this work because it still needs to be done. There'll be a time, none of us will live to see it, but there'll be a time when this work will be less necessary. It's always going to be necessary, but it'll be less necessary. Health Brigade, apparently other local experts on trans experiences. Yes, wonderful. There's also Nations Foundation, Nations with a Z. A good girlfriend of mine, Zakia Jamasier in Richmond, is the executive director and founder. The Fan Free Clinic, I used to get hormone therapy from the Fan Free Clinic years ago. Is it still there? It's called something else now, right? Nobody knows. Okay, so just something to think about. All right, so let's go to the next one. Yeah, and there are a few resources in the Tidewater area also. Let's go to the next poll question. Thank you all so much. Peter's Place, wonderful. Health Brigade, thank you. All right, should we treat the substance abuse or HIV first? I can't wait to see your responses for this. substance abuse, together, both, dual diagnosis, you treat them simultaneously. Substance abuse first, interesting. Why is it either or? Both, interesting. I like where this is heading, both. Ask the client, finally. If that was Warren again, Warren, we're going on a date. All right, treat the whole person and treat both at the same time. What does the patient prioritize? Yes. HIV. Ask the client, bam. Both, okay. So I wanna again make it clear. So the first two poll questions, there were a couple of wrong answers. But on this one, there's no right and no wrong answers. But I will say from my expertise, the most appropriate clients is just what somebody just typed. It really depends on the client. It really depends on the client. There are some people for whom the clients may be somebody, thank you, Tamika, may be someone who can prioritize HIV care and not their substance abuse issues. And it might be the other way. Every person that walks into our clinic, we understand the gold standard and the goal of the EHE is to get people connected to care within 90 days. That doesn't always work out. That is a goal. It is a goal. And it is something that we will continue to be a goal. But for every client, that's HIV care should not always be the very first thing. For some people, substance abuse care should not always be the same thing. I mean, should not always be the first. So that's where, and the reason I put this is kind of a trick question. You really have to build a relationship with the client to find out how they're going to be able, what they can prioritize first. You might have to treat both simultaneously. Sometimes people have to dry out in order to even understand how to take care of their HIV. Okay, so it was kind of a trick question. None of your answers are incorrect, but what this question speaks to really is about developing a relationship with your clients to find out what is best for their situation. There is no one answer that's going to be right for every situation. So it's kind of a trick. And you all passed. Good. All right, let's go to the next one. I saw homeless there, and remind me, if you will, to address homelessness, just the homelessness and HIV care and trans people, Mark, before I finish my section, because I think we're always done. All right, so here's some talking points. We don't have any more poll questions. Thank you all for participating in the poll, for each of you who did, and for each of you who didn't. Thank you at least for paying attention to that. All right, so these are just some talking points, because as we really start to wrap this section up. All right, so some of you are going to end today's conversation. You're going to say, I still don't know what to do. The best thing that you can do is something. Doing nothing is not an option. Some of you are restrained by the parameters in which you work to make big changes. So change your entry forms. Change where you market your site. Change by creating diverse community advisory boards that represent the community. Change by educating yourself. Thank you for that. Okay, we can't all make institutional change. There's not, I don't, based on some of your positions, some of you can't go in and change the whole organization from top to bottom tomorrow. And Monday they go in and it's the most trans-friendly clinic in Virginia. Some of you can't do that. Some of you can, but some of you can't. And yes, Tamika, I love you. It does, so much of this does start with a conversation. It starts with a conversation with your staff. And It also means bringing in trans people from your area to tell you what needs to be done. Listen to the folks that you're serving. Mm-hmm. They know what they want and what they don't want. I have private insurance and I live in Atlanta. So what the hell do I look like going to Roanoke and telling Tammy how to run her clinic? It's stupid. Now, trans people, I can give you some pointers, but trans people in Roanoke can tell Tammy what to do in Roanoke. That works for them. Okay? Does that make sense? All right. Oh, here's another one. This is what we hear. I talked a lot about white people. I talk about Black people too. I talk about all people because this is really a POC issue right here. Oh, let me tell y'all. All right, let me do this real quick too. So let me tell you why POC can be a problematic term a lot of times. So POC, people of color, is everybody that's not white. Again, it defers to white as being right and everybody else is being something else. And so we have to be very mindful and intentional. If we're talking about people for whom Spanish is their first language and we use the term POC, you're missing the boat. Does that make sense? POC is everybody that's not white. You're othering everybody in favor of white people. White people don't think about this stuff, but it's true. Okay, so my cousin is gay. This is what Black people say all the time. So I have a gay cousin and we treat him, her, whatever child. We treat them, we don't have these kind of issues in our family. So what's wrong with all these trans people? That's what we say, because you got a gay cousin. You made that about trans people. That, first of all, is foolish. It's stupid. That's the first thing. And that's your cousin. That doesn't mean just because your cousin doesn't have these issues at the cookout, doesn't mean that they don't have these issues when your cousin goes in to take a test for HIV, or when they go in for PrEP services, or when they go in to get blood work for a doctor's appointment. All right, so there are times when we can personalize this stuff, but remember, your opinions don't matter. We have to take ourselves out of, we have to make sure every person that sits in front of us or near us or somewhere, that they have history that they're bringing into this setting. A lot of the history, I do presentations on historical trauma, which is rough. It's rough. My goal is to make a few people cry when I do it. It's rough. But then, like, after that, I have somebody, a therapist or a counselor, close out the session because it's rough. Because we forget in our cushy lives that there are folks who have even more issues than we do because of the commas. See how I brought that back to the comma exercise that we did, Mark? You like that? That was good, right? Yeah, so we have to remember that. So your gay cousin is just your gay cousin, all right? And what's wrong with trans people? The fact that somebody is sitting here thinking that, that's what's wrong with trans people. Your ass. Okay, so 7 minutes, thank you. I'll be done before then. So isn't being transgender just really, really like super gay? Tammy, I see you shaking your head. You know, somebody on this call was thinking that before today. So can you tell folks, in your opinion, what in your thoughts, why that's such a stupid thing to say or believe?
It's stupid because being transgender is your body conforming to what you were born as. And it's a whole different person. It's not you wanting to be something else, you wanting to be whole. It's transgender. And your accountability of whole is becoming who you are on the inside, outwardly, so you can be complete. So it's not just being gay, because most transgender women, they just love being their self. It's not a it's just being who they are completely. Like, you should be happy being who you are every day you wake up, and they want to make sure the outside matches the inside and be happy with who they are. Some take it to certain extremes, some don't. But you have to love who you are, and being transgender is not just being gay. It's a wholeness to me.
Thank you. Thank you.
You're
So here's
welcome.
a simple way. Thank you. And I see all the comments in the chat and I love it. So here's a simple way to think about it. This is not comprehensive. You will not pass your doctoral thesis if you do. It's a way for you to think about it. All right. So my gender is here. It's how I think about myself. Okay. My orientation is here. It's who I'm attracted to. Here and here. Does that make sense? And I have big boobs, so I have my hands on my chest. So here in my brain, that's who I am. That's how I go about life. I don't give a fuck what you see. I'm telling you who I am. This is who I'm attracted to. This is who my heart yearns for. It's here. This is where orientation is, okay? Oh, I used the F word. That one kind of slipped out. Brad, don't mess up my chat. All right, so here's number 9. This is a good one because in Virginia, we still hear this a lot. So my religion forbids me from calling a man a woman. So here's something that everybody doesn't know about me, Mark. So I went to Virginia Union Seminary. I didn't graduate from there, but I went to Virginia Union Seminary because I love God and my relationship with God. And interesting enough, and I went as a trans person. Seminary, they didn't know it. Seminary actually reinforced my trans identity because I realized that the bullshit that I heard in church, most of it was wrong. One of my grandmothers, she is gone on to heaven now, as we like to say in the South. But we were having a conversation, this is many years ago, we were having a conversation about men in dresses and all that kind of stuff. Because my girl cousins were asking me for my old clothes. Because they, whatever. Tammy and I like to dress. And we like clothes. And so my grandmother was getting pissed off because she didn't understand my trans identity. And I was like, I don't understand it either. I just know it is what it is. Just as simple. And so we were having a conversation. I don't understand men in dresses. I don't get it either, Mom. I don't get it. But then I asked her a question and it made her have to think. And I ask all of you this question, those of you who are religious zealots and those of you who are even religious bigots, because there might be a couple of you on this call as well. Name me one man in the Bible who wore pants. Thank you, Mom. Which one was it? Okay. Crickets, right. Okay, so I'll go to the next one and I'll finish this out. Okay, so why can't trans people just stop complaining and do what else everybody else is doing? So let me make it abundantly clear. Trans people are doing what everybody else is doing, complaining. Next question. Because some of y'all are still fucking it up for all of us. All right, so number 11, I don't understand why someone wants to be transgender. I don't understand it either. I just know that as human beings, that all of us want to and deserve and should and need to be free and full. And that particularly when we're talking about HIV care, we know that when folks are withholding information that is important to their HIV care, that it creates worse health outcomes. It creates additional stress on their minds, their hearts, and on their lives. And it makes it much more difficult for them to get to undetectable, which for many people is the gold standard. It makes it more difficult if a person is not able to live and navigate in society. It makes it more difficult for them to take a pill every day or a shot now once or twice once a month or twice a month. And so as trans people, we're not asking for anything that other people don't already have access to. It's just that simple. And that's especially important when it comes to HIV care, okay? And I think that's my time with about 90 seconds left. Mark?
Yes.
Equity, yes.
Yes. Tori, this was such a great presentation, really, really informative. And I just want you, a couple of things, takeaways from this is Black trans rights are civil rights, and trans and non-binary individuals just want to poop and pee in peace like everybody else. And when you said that, it was an aha moment for me because I never thought of it like that. So great job, standing ovation. I bow to thee, my queen. Phenomenal. And so this is the end of this presentation. And now we're going to move into Julius, who's going to close us out of our day. So thank you all for coming to this presentation. Tori, big ups, big ups. Great job, everyone.
Good evening. My name is Julius Hambule. I'm one of the HIV services coordinators at the Virginia Department of Health. I just wanted to say that the last few days we have had great information. I've learned a lot. And I just wanted to reiterate one more time the main topic for this QM Summit, changing your lens to enhance quality. And let's think for a second about that topic. If you look at all the great information that we have received for the last 2 days, and I will just mention a few of them. We went over the transgender health study. We went over Cabenuva. We went over the treatment and consumer engagements and all the wonderful information that we have learned for the last 2 days. I just wanted to give thanks to all of you for attending the QM Summit. And I wanted to give thanks to VCU, specifically Brad Williams, for putting together these presentations and also the logistics and making sure that the events for the last 2 days have been successful. I also give thanks to VDH, especially the DDP and HCS unit for financing the QM Summit. I wanted to thank everyone one more time for attending, and please make sure that you fill the evaluations and also look out for the emails after the meeting to make sure that you respond, because these will obviously help us to plan ahead again for the next summits and for the next meetings. I also wanted to just make sure that use the information that we have received for the last 2 days, apply it to your programs so that we can improve the lives of people living with HIV and also have a great quality services for our clients. Thank you so much and have a good evening.